Welcome to Adapt English practice question on nephrology, renal, urogenital system. I know these are areas that is very troublesome. I have 15 questions just to show you some areas that you need to know. If you need more content, check Adapt Class. Nephrology is a key aspect of it. Let's get to it. So the first question will work on test taking strategy. Which action should the nurse take first? That means it's a priority. You have to be sharp, not an expected finding. A client with acute kidney injury and a serum potassium of what 6.8. That's a bad number. That's really bad. The bar's rate is 6.8. What is it going to cause? It's going to cause problem, a lot of cardiac issue, hyperkalemia. What do you want to do? Where is it going to affect? The first thing hyperkalemia affect is your heart. So you stabilize your heart before you treat it. Therefore, polystyrene sulfonate is usually Kayexalate. It takes a long time. You have to take it by mouth. It does not act that fast. You can use it as an enema. Hemodialysis will take time. You can't just do it right away. I told you got to protect your heart. Calcium gluconate is what is going to protect your heart. Giving the patient fluid is not going to help with your potassium. Which assessment finding require immediate intervention? Prioritization 101. That means bad stuff, not an expected finding. What do you think is unexpected? You have to be sharp. A 6-year-old child is diagnosed with what? Acute post-streptococcal glomerulonephritis. Think about it. They have strep infection. All of a sudden, they have glomerulonephritis, inflammation of your kidney. The glomerulus does not filter things anymore. Blood go into your urine, protein also go into your urine. You start having signs and symptoms. Due to the bleeding, you have tea-colored urine. Unexpected finding. You have to be sharp. You lose a lot of protein also. You have periorbital edema. Unexpected finding. You may have protein in your urine. Expected finding. When you retain a bunch of fluid because your kidney is being damaged, you have hypertension. Early signs of encephalopathy, brain issue, ICP, is hypertension. So for post-streptococcal glomerulonephritis, you can have all the things I've talked about, but as soon as you start having blood pressure problem, your blood pressure keep on going up, that's a priority function. So this is priority. Which dietary instruction is appropriate? And nurse is providing digital teaching to a client with the history of calcium, 1, oxalate, 2, renal calculi. That means you're forming kidney stone due to what? Calcium and oxalate. If you provide teaching, what do you want to focus on? Tell the patient not to eat anything that has calcium. Don't eat anything that has what? Oxalate in it. Number 1, vitamin C increases oxalate absorption. Reduction of sodium will prevent you from excreting calcium into your urine. And if there's more calcium in your urine, you form stone, calcium oxalate, usually calcium component. Consuming a lot of spinach will give you more oxalate. Avoid drinking more than a liter of fluid a day will make you form kidney stone stasis. So what is the best answer? Is reducing sodium that will take less calcium into your urine to form stone. So this is the right answer. Which assessment findings suggest prostate cancer rather than benign prostatic hyperplasia? That means there's two things. Either you have cancer or your prostate is bigger. Buzzword is cancer. Buzzword is cancer. A 72-year-old male report difficulty what? Starting urination, weak stream, and nocturia. Guess what? All of these symptoms, you can see it in BPH or prostate cancer. But there's certain things you can see that will tell you this is BPH. Number 1 is enlarged and its firm prostate on digital rectal exams is consistent with BPH. Both of them are going to have difficulty initiating urination. right? Both of them may have urgency, but the one that will tell you this is cancer is irregular, asymmetrical prostate on digital rectal exams, not a uniform, enlarged, and firm nodular. So this one, which is what is the priority next action? That means you have to sharp password. What do you do first? 25-year-old client present with what? Fever, okay, flank pain, dysuria, well, painful urination, frank pain, fever, sound like urinary tract infection. Renal analysis represent reveal white blood cell cast, yes, infection, and significant bacteriuria. There's bacteria in urine. That means we have to treat it with antibiotic. What do you want to do? You get a culture, then you give them antibiotic. You encourage oral fluid intake, it's okay. You give them Tylenol for pain and for the fever, it's okay. You prepare them for dialysis, no, you don't. So ABC is what you do. But which one you should prioritize? Prioritization 101. You should obtain culture before giving them antibiotic. Which order should the next question? That means something is wrong. A nurse is caring for a client in oliguric phase of what? Acute kidney injury. Which of these should you question? The keyword and the content related to this. If you have kidney failure, renal failure, you don't just start from renal failure. All of a sudden, you have renal failure. There's changes that will occur, right? There's an acute injury, right? That is oliguric phase. That means your kidney cannot make urine anymore. What happened? You retain fluid. You have hypertension. You have headache. All those you retain fluid. So in the oliguric phase, before it become diuretic phase, you peeing a lot. Your kidney is now crazy. First, it doesn't pee, and now you wake up, you start peeing before it normalize. So in the oliguric phase, where you're not peeing, we should limit fluid. In the diuresis phase, where you peeing too much, you can get dehydrated. So we need to give you fluid. This is the content. That's all. Oliguric phase, you should not be getting too much fluid. We can restrict you to like a liter a day, right? So restrict sodium is good so that you don't retain more fluid. Measure the individual daily weight to make sure how much fluid they're retaining. Kidney is not working, you should limit your potassium. If you give them fluid 125, they're going to get more fluid overload. So the nurse is appropriate to question this order. And this is providing discharge instruction to a client after extracorporeal shock wave lithotripsy for kidney stone. Which statement by the client indicate a need for further teaching? Select or apply. What it means is the patient has kidney stone and we broke the stone using laser. You are supposed to pee all the stones out. There may be blood that comes out as the stone comes out. You may have some bruising in the area we put the laser. So these are little things you have to know about this procedure. Extracorporeal shock wave lithotripsy is a bunch of words. That means I zap you with the laser into your kidney and break the stone. So I will limit my fluid intake. It's not good. You got to drink a lot of water to get rid of the stones, right? So further teaching. I should expect bright red urine for a week after procedure. That means you're bleeding. You shouldn't expect bright. You should expect like Kool-Aid like pinky. Need further teaching. I don't need to strain. You need to strain my urine since the stones were broken up. No, we want to see them. They coming out. Further teaching. If I develop a fever or chills, I should rest and drink more water. No, you should let the doctor know. I should avoid taking NSAID like ibuprofen until my doctor approve it. Yes, you shouldn't take it because you have kidney procedure. I will stay in bed for 48 hours after procedure. No, you should wake up and move. I may develop bruising and slight pain on my back. Yes, where we apply the laser, you will expect that. So those are the two answers that are normal. The rest are all abnormal. Wrong answers. The next is assessing a patient receiving continuous bladder irrigation. Which findings should the nurse report to the healthcare provider immediately? Continuous bladder irrigation is used when you have TERP, like we irrigate in the bladder, put some fluid there, irrigate it. If the client report low abdominal pain and bladder spasm there may be obstruction. It's not good. Urine output is lower than the amount of irrigant. The urine output should be more than what you put in. The irrigant is how much you irrigating, but you also making your own fluid. So if you put in 100, you have to make a urine too. If you make a urine 120, urine 20, a total output should be what? 120. So the urine output is always higher than what you put in. So this is concerning. Yeah. Urine remain bright red despite increasing flow rate. It means you bleeding. Catheter drainage has multiple large clots. You bleeding. And the patient heart rate is 58 and dizzy. You bleeding. Which intervention should the nurse include in the plan of care? Select and apply. A nurse is caring for a client in what? Oliguric phase of what? Kidney injury. First phase, the kidney is mad. It doesn't put out anything. You should check there with daily weight so that they don't, you know how much weight they're gaining and how much fluid they're retaining. Because the kidney does not work, you should avoid potassium products, right? Limit fluid intake is that you get fluid overloaded. So limit fluid is a good thing. Monitor for crackles, edema, hypertension, right? If you retain too much fluid, your blood pressure goes up, you have edema, and it goes to your lung. You should avoid high protein because your kidney is not doing well. A child with a nephrotic syndrome is admitted. Which intervention should the nurse question in the plan of care? Select and apply. What is the buzzword? Nephrotic syndrome. What is the keyword? Question. What do you want to do? Look at it and see if it's consistent with nephrotic syndrome. In nephrotic syndrome, the glomerulus is losing a lot of what? It's become leaky and you lose a lot of protein. In the process of losing protein, you have massive edema, hypertension, all the signs, periorbital edema. Because of the loss of protein and the use of steroid in these people, they have what? High risk of infection. So we should monitor for signs of infection. That's good. Because they have fluid retention, we should lower the sodium intake to prevent more edema. That is good. We use steroid to control the disease process, so that is good. We should assess how much protein they're losing. That's proteinuria is good. We should not increase fluid because then they have more edema. So this is the only one that we should question. A nurse is performing assessment of a client with a newly created AV fistula for hemodialysis. Which findings should the nurse document as concerning or report to the healthcare provider? That means bad stuff related to AV fistula. AV fistula means arterial and venous are come together so they can use for filtration of the blood. The fistula is warm to touch. It may be infectious. We need to tell the doctor. Presence of firm tender mass at the fistula. It may be thrombosis, obstruction. Decrease or absent trail over the fistula. That's a problem. Is thrombosed. Client report persistent numbness and thickness. That's the Steele syndrome. You're losing blood is being directed away from your hand and you're going to the fistula. That's why you have numbness and tingling. Fistula appear red and swollen. Infection. Therefore, all of them are bad. Which assessment finding will indicate that the nurse should hold the medication and notify the healthcare provider? The nurse is preparing to administer phenazopyridine to a client experiencing symptoms of UTI. Phenoxypyridine is used for UTI, but it's an analgesic. It's not antibiotic. So just make sure the patient understand the content related to that. It's for analgesic. So it helps with the burning and the spasm that is going on. So which of these, when you know about it, you should hold the medication. Client report the burning sensation during urination. That is the reason why we give them. You should not stop it. Client has a history of liver disease. This is cleared by the liver. So if you have a liver disease, it's a problem. Client urine is dark orange. You change your urine into dark orange and all your secretion is okay. Client has allergy to sulfur. The medication is not sulfur related. So this one, liver problem. Which assessment finding indicate that the medication is having the desired effect. That means doing what it's supposed to do. And then it's administering polystyrene sulfonate to a client with what? Electrolyte abnormality. Go for the buzzword. Polystyrene sulfonamide, right? Sulfonate. What it is a Kayexalate. What does it do? It decreases your potassium. What is the therapeutic effect? Low potassium. Just because you have decreased muscle weakness and cramping doesn't mean your potassium has improved. There may be multifactorial. There may be so many things related to that. The only proof that this medication has worked is I see potassium before. Developing a plan of care for a client diagnosed with what? Multiple kidney stone. Which intervention should the nurse include? Select or apply. Encourage fluid intake at least 3 liters. Yeah, if you have kidney stone, we want you to drink a lot of water, hydration. You should strain all your urine to collect fragments. That is good. You should take an analgesic because of the pain. You should walk around to help the stone move around. When you take too much sodium, you push calcium into the collecting tubule and they can form stone. To decrease it, limit your sodium because then that will prevent exchange with calcium. And therefore, all of this is good. Thank you for watching and good luck in your exams. Bye.